for short, is a project set up by parents for parents in Southwark to reduce isolation, build a community where individuals support each other and contribute to solutions. Covid-19 and the subsequent lockdown struck at the very core of what we do. But because of the relationships we already had with hundreds of parents and their families, we have managed to quickly respond by transferring 95% of our activities online using Zoom, our website, and social media platforms. We have listened, starting with the most vulnerable, to find out how the lockdown is affecting our community. Food poverty, fear, anxiety, and digital exclusion are some of the additional challenges they are facing. Many of them don't have the skills, connectivity, or suitable devices to access support and resources, including their children's online learning. What we have done is what we always do. We listen and encourage parents to stay connected with each other, share their stories and strategies for coping through audio and video recordings, written blogs, etc. We have secured additional resources to improve connectivity, provide equipment, and support those with limited digital skills. Our partners are providing food and baby items to the most vulnerable, but none of this would have been possible or timely without the relationships that we already have. What a difference a project like PACT would have made to me back when I was depressed and parenting young children. I was trying to fit into systems and structures that felt like they were designed for someone else. I found no sense of belonging or no opportunities to be part of the community, to share and contribute. I believe if we can be a little bit more flexible, patients, parents, professionals, even children can work together towards meaningful and long-lasting mental health solutions. The impact of COVID-19 means there's just not enough capacity in the system to help everyone. Thank you very much.
Josephine, thank you so much for sharing your story with us. And I know that you're going to hand over to Laura, who's joining us over the phone.
Yeah.
To share her story.
It's over to you.
Yes. Good afternoon. My name is Laura Marziale, and I'm the director of Creating Ground, an organization that uses the arts and community education as a way to bring people together, improve well-being, and create change at a personal and community level. Many of the women who come to our sessions have had a very difficult past. Some actually have a very difficult present, and almost all have known what it means to feel lonely, isolated, hopeless, vulnerable. Some of the women still live in refuge or temporary accommodation. Some rely on charities for their basic needs. Some have been in a limbo waiting for their papers for years. And some have been abused by landlords or employers because of their vulnerable status. Despite all our difficult stories, though, we have become a very strong team. Face-to-face interaction is vital for us, but we are now meeting online, and we have learned a new way of being together. During this lockdown, it has become even clearer to us how important it is to be part of a group for our mental health. The sense of belonging to the group that we have continued to experience despite the lockdown has been essential for our mental health. Being part of a community, feeling that you belong, helps you as an individual. Going through hardship with others makes you feel you can overcome the problems. It's about being inspired by others and inspire others. If we are stronger in the group, and thanks to the group, we may become stronger as individuals. We take for granted it's actually not. For some people, the reality is made of only themselves, and if they're lucky, maybe their children or their partners. When working with migrants, sometimes it's believed that providing basic needs is what is essential. Of course, it is a priority to have the basic needs met. However, being and continuing to be part of a group, feeling valued, listened to, acknowledged, are equally important factors for social inclusion and well-being. To nourish community resilience, groups of people who otherwise would have been isolated need to be given the chance to interact with others, to meet and socialize, create a network, to have fun and learn new skills with others, to feel valued, understood, and appreciated. So my main reflections are that belonging to a community where you feel valued and safe leads to well-being and individual resilience, which in turn translates to community resilience. Supporting this group is vital for our communities to flourish. Support services should look at the holistic needs of the individual, and after COVID-19, it may be difficult for individuals, especially the most isolated ones, to join community groups because of fear of interaction. So a lot of work needs to be done to encourage these relationships to happen. So I will just finish my presentation with a question, which is the challenge that we face as an organization, how to build these communities during and after this challenging time is over. Thank you so much.
Thank you so much for that, Josephine and Laura. Such powerful stories, and what a good question to leave us with. So we are now going to turn to our panel, and I'm going to actually turn to Pete Brearley from Citizens UK to perhaps answer the question, what do you think the impact of COVID-19 is going to be on the mental health and resilience of our community?
Yeah, hi. Thank you so much for having me on this call. My name's Pete Brearley. I'm the lead organiser for London Citizens, which brings people together to give them power to make change on the issues that they care about. And we've heard kind of several times about the huge hit that communities are facing with this pandemic, from food poverty to those struggling with no recourse to public funds, to housing insecurity and job insecurity. But I mention those first because obviously they all have an impact on our mental health and well-being. But the reality is that there's no one of the real keys is actually whether or not those people and those of us struggling in those situations can rely on, connect with, confide in, and get support from other people, because you can't get well on your own. And actually, we've heard a lot about the role that communities have to play. And I think the ongoing impact of this crisis will be determined by two things. Number one, whether or not we as members of our communities continue to reach out beyond ourselves. And it was great to hear Gregor talking about the stats about how the increase of volunteerism, the willingness of people to be more neighbourly. But it will also be about whether or not local councils, mental health trusts, CCGs, STPs can seek to invest and work within a real way to build that resilience and to act on that prevention. Because the problem with prevention is sometimes it's not good politics, because you can't prove what you're doing in the immediate term. But actually all the studies show that if you invest in prevention, then you get a better result. The final thing I will say is there is hope, and it's been brilliant to see those sectors coming together, working together. It's obviously great to have all of those sectors represented here today. And it's been brilliant, I have to say, to see members of Citizens to show that in the face of this difficulty and adversity, that there is hope, that we can maintain resilience, from kind of phone trees and phone banks of reaching out to the elderly and the isolated, to mutual aid efforts, to providing computers for the digitally excluded. It's absolutely what we need to do. The question is we absolutely have to harness that energy and direct it and prioritise it towards this mental health crisis.
Pete, thank you so much for that. I'm going to turn now to Tom Brown, who's Executive Director of Community Services at Lewisham. To Tom, with your views on what do you think the impact of COVID-19 is going to be on the mental health and resilience of our community?
Thank you very much. And I come at this as a very grand title, but I always say I'm a social worker is my day job. And for me, part of that means thinking about how we connect as communities, because we're social creatures by instinct. And I think the challenge of COVID is that we've fractured a lot of the connections that we normally have. We aren't able, after 10+ weeks of isolation, to keep up those veins that keep us alive, that keep us well, that keep us meaningfully connected to the society in which we live. So the loss of those connections, the powerlessness, and indeed the real fears that come with COVID, the anxieties. Will I be the next one? Will I be somebody that ends up in hospital? That disempowering anxiety can lead us into a spiral of withdrawal, of further isolation, and that of itself takes us, you know, into a vicious circle. Add to that people who are marginalized and powerless already, and the cards are really stacked against you. But there's positives that are coming out of this as well. We've had to radically rethink the way that we interact with each other, and we have used technology in ways that 2-3 months ago we would never thought of working. Families have connected through FaceTime, through Zoom, through apps that only my kids know the names of. There's been tremendous focus on, we've had several people using great examples of where we've connected with our neighbours, where we are doing things to help our society stay connected. Here in Lewisham, we've got 2,000 volunteers who are supporting a shielding hub every day. Stuff that is absolute fabric of what we want to build as a positive society. We've got to use those community assets. We mustn't let them go. We've got to make sure that we invest and capitalise on this. We've got to find a way, I think, as Pete just said, to release the resources from the sharp end and invest in that prevention, that community resilience and cohesion to help to stay connected. So what can we do as individuals? What can we think about the things that energise us, that give us a buzz, the things that make us feel connected, the things that help us to stay connected to our families? Those are the things for me that, as members of families, as employees, as citizens and as parts of communities, we've got to use the opportunities, the things that we've learned during COVID, to build on and to remember as we go forward. Thank you very much for that, Tom. That's very pertinent. I'm going to pose the same question, if I may, to Dr. Emily Finch.
Thank you, Andrew. My name's Emily Finch, and I'm a psychiatrist, and I'm clinical director for SLAM in Southwark. I can confirm really what other people have been saying, that for many of our most distressed service users, COVID has been a really, really difficult time. And we're seeing people who are normally quite mentally unwell becoming more unwell. They're experiencing more crises, and they are often physically unwell, and they've often lost all the support that they previously had. Like the rest of us, they're frightened, and they find it always difficult to access services, and they're finding it even more difficult at the moment. SLAM has changed the services it's provided like everybody else. Much of what we're doing now is online. It's by telephone, and while many of our service users have coped really well with this, and many perhaps of the most surprising people have managed to access services remotely very well, we are quite well aware that there is a group who don't access things so well, and we're probably not able to reach out to them as much as we would like. And that's for complicated reasons. You know, we've had to close some of our services because to protect our staff, and also to protect the acute hospitals and other reasons. But we're struggling, and we're trying very hard to maintain the best level of services we can. There's been a lot of talk about communities this afternoon, and we're well aware that we're likely to be seeing increased distress in people who wouldn't normally provide our services, use our services. They're not people who would normally think of themselves as mentally unwell. They're, however, under a lot more stress, particularly BME populations, but families are suffering separations, they've suffered bereavements, they've suffered significant financial stress. We have many low-income people living in Southwark, and we've had the demise of the hospitality industry. We've got whole groups of people where, frankly, the bottom's dropped out of their lives in the last few months. And we know that they're likely to be the people who are least well supported and are going to start suffering from anxiety and depression and maybe alcohol and drug problems, things that they wouldn't have normally thought they were going to do, normally thought they were going to suffer from. And some people will deal with it. Some, perhaps the most supportive, I can go back to Gregor's lists of people who are more resilient and people who are at more risk. Some will manage to deal with it, but others are going to need more support and help in order to get through what for them will be a very difficult time. I'm very aware and I've always been aware of the fact that whatever SLAM provide, we only contribute a very small amount of people's mental well-being. So seeing a psychiatrist, taking a psychiatric medication, having a recovery intervention is only a very small part of what makes people mentally well. And SLAM has always done it and is now acutely aware that we have to reach out to the positive work and the positive community resilience that has happened over the last few months. Some people have been able to access it, others haven't. The good thing is many of our service users are helping others. We know that's going to be important for them. And as we're part of the solution, we have to recognise that that's what we can deliver, the clinical services we can deliver are probably only a small part of what will help. And we also have to support community interventions, support community services, and make sure that we connect our service users in the best possible way with the things that are most likely to help them. And hopefully, in order to give people the maximum amount of support they can possibly have.
Thank you so much for that, Emily, and very much appreciated. I'm going to hand over to Peter John, who's the leader of Southwark Council, if I may, to ask a different question, which is, Peter, what do you think are the top priorities that we need to work on together over the next 12 months to help our communities manage their mental well-being and prevent mental ill health?
Thanks very much for that. I mean, I think it comes back to some of the things that I was talking about earlier on in my presentation in the plenary session. There will be, there are going to be a number of people who will be impacted because friends or loved ones have died during this crisis, and a borough like Southwark, there are many hundreds, if not thousands, of people who will be impacted in that way, or they will have been incredibly sick during the illness. So it's the support that we need to give to them. Then there are the many people who, as others have referred to, will be threatened with unemployment, continued furloughing, continued uncertainty about their work. And then there are those who remain in work but are very concerned about their finances. And again, we know concerns about finances lie so much at the heart of mental ill health and worries in those regards. So I think, kind of those are the three primary issues that we're going to be faced with. As I say, I think one of the roles for us as a council, as well as financially and in other ways supporting the work that we're doing to ensure people's mental ill health is good, is create those jobs, but also try and imbue that confidence in our community and in our area, which I think will be critical as we come out of this crisis. People have to feel confident about living in Southwark and South East London and in London. So whether it's cheerleaders in chief, you might say, well, that's not that important, but it is actually, because I think people need to have that sense of confidence about their place. What can we do to celebrate the fact of living in Southwark and living in central London? That's something I think that we as councils can do and help organise. People, again, have taken great pride in their communities during this, and we need to make sure that carries on, that we don't lose that sense of place, that sense of community, which has been so present during this. And as I say, I think we as councils can be enablers and supporters of that, not imposing on communities, but helping communities do it, celebrate all that is good, because I think that will help people, as well as those, as I say, those steps that we can take to get people into work, give them the skills and training that they need, and also help them when things really are bad and they need support from services like SLAM or interventions from the council or the hub or whatever.
Peter, thank you so much for that response. We've had quite a lot of comments come through the Q&A chat, so I'm going to open this up a little bit wider. I'll start with yourself, Norman, if I may. And one of the questions that we've had is how are we going to provide services for those people who've never had mental health issues before COVID, but as a result of the lockdown now do? What will we do differently, and what is SLAM's commitment within that?
Well, first of all, I think it's been a very rich discussion. I did just want to say that Josephine and Laura, in the contributions they made, I think demonstrated just how powerful community organisations can be in supporting people. And I think it's important for SLAM to recognise and understand that. And we recognise that there may well be a lot of new cases of mental ill health coming forward as a result of this crisis. And there is some evidence of that already in terms of presentations at emergency departments in hospital. But I think the whole sort of thought I had behind coming up with this idea of a summit and a plan of work beyond today is that as an organisation we can sit back and wait for people to fall into crisis and then do the sort of thing that mental health services have always done, treat people as well as possible, or we can help to be part of the solution, stopping the deterioration of health in the first place. Working in a way as a centre of excellence, but collaborating with others, having a degree of humility, recognising that there are lots of other perspectives as well. I very much like the way Peter, John just now talked about how we need to sort of empower communities and recognise the richness of our communities and have a positive outlook about how we can work our way through this, rather than it being seen as all doom and gloom. There's so much to celebrate in our communities as well. But I think that by collaborating together, working with organisations such as those represented by Josephine and Laura, we can help support people more effectively than simply waiting for crises to happen. And I think that's the big sort of shift that SLAM has been involved in for a time, but now becomes an absolute necessity for us in collaboration with the local authorities and with community and faith groups.
Thank you very much for that, Norman, and that's a very pertinent response. I wish we had more time for this session because we're very fast running out of it, but I wanted to just pose one question, if I may, back to you, Josephine, if I can. Somebody's asked, they've said it's really important to harness energy from volunteers and also to bring together all our stakeholders to join the conversation. How important do you think the role of volunteers are in making the change that we've just spoken about?
I think, is there an echo? Sorry, I don't know what to do about it. But yeah, I was going to say we rely very, very heavily on volunteers in our service. And it is about including people, because a lot of people can do things for themselves, they can contribute, but they often don't feel that they can, either because they're intimidated or because they don't have the right papers, or they don't tick some kind of box. And what we do at PACT is, regardless of people's status, if you've got a baby in your arms or you have a pram, you are welcome. And we try and encourage people to contribute what they can. They don't necessarily have to have a DBS check, but it's about getting people to feel valued. And so that is why for us, even parents just contributing what they can, whether they just hold up a sheet of paper to do a song or to lead a workshop, even if it's just a question, rather than, getting somebody else to tell them what to do, that we start with them and ask for their solutions. And I think volunteers are absolutely in the same category, that if where people, you know, we've got volunteers with learning needs, and yes, it is a little bit more taxing, but they do feel valued. And I think that that is really important in creating a thriving community. Thank you.
Josephine, thank you so much for that. And thank you to everybody. Now, before we head back well, before we say thank you to all our panelists, I want to say thank you very much to all the delegates who have joined this session. And for those of you who've put your questions and answers, I'm sorry if we haven't had the opportunity to be able to respond to you, but we do promise that we will take all of these away and that we will post them up onto the SLAM website where we will provide responses. Thank you so much to everybody who's replied saying they really want to get involved in this work, and that's fantastic to hear. But my co-facilitator, Alex, is going to share the link for everybody to join back into the main session. So you will see that link appearing any moment now, and please do use that link to go back into the main session, or alternatively use the original link that you used to join the session in the first place, just to come back to the main event. So you can just use the existing link that you used to get into the main event to rejoin the rest of the group. So I hope I've made that fairly clear. If you can just use the link that you used to get back into the main event, that'd be fantastic. And what I'm going to say to everybody on the panel is thank you so much. We're very grateful for your contributions. This is the beginning of what will be a very rich programme, and thank you very much to our expert by experience, Josephine and Laura. We're very grateful. To everybody else, please use a link that you used previously to get back into the main event session, or click the link that has been posted on the Q&A function. We'll see you in the main room very shortly. Thank you very much, everybody.
Thank you.
Well done, Ranjit.